Nurse Marie here again. Hello, everybody. Um, this is another episode of Marie's Message 411 TV. This is Nurse Marie bringing you an article about the rise in HIV and AIDS. Yes, it's rising again. HIV rate of black women in Florida is on the rise, and health officials say World AIDS Day on Friday, November 29th. It's a day meant to raise awareness about the AIDS epidemic and provide information about HIV prevention. Though HIV isn't a death sentence, it's not a death sentence anymore. Local medical officials want people to know that the virus is still here. In fact, according to the Florida Department of Health, over the past couple of years, there's been an increase in the HIV rate of black women in Florida, with Pinellas County standing out. Dr. Bob Wallace runs Love the Golden Rule Clinic in St. Petersburg. He still remembers treating patients who contracted the virus back in the 80s. Unfortunately, every day was a death camp. I had I had buried over 500 people between 1987 and 1995, Wallace said. Seeing how society and the medical community often discriminated against those living with the virus, Wallace wanted to be a part of the solution. I'm blessed with the fact that I was able to help be a leading investigator on a drug called FTC, which is now part of our 10, combina- 10 combinations of medications, Wallace said. We did that study right here in St. Petersburg. But unfortunately, here in Pinellas County, women have, here in Pinellas County, women of color, their numbers have doubled since 2021. I'm going to read that again. We did that study right here in St. Petersburg. But unfortunately, here in Pinellas County, women of color, their numbers have doubled since 2021 to 2022, right? ABC Action News' Anthony Hill wanted to learn more about this trend and find out what's being done to lower that number. He spoke with a local nurse practitioner who works in some of St. Peter's most underserved communities. She works in St. Peter's most underserved communities. Nurse Robin Taylor sees many of her HIV patients in a typical doctor's office setting. However, many people in the community know Robin from a different setting. She's often in these neighborhoods on the ground providing health care services including HIV testing. She says, I want to meet people where they are, get the message out, and let them know it's okay, Taylor said. That stigma that was there back in the day when HIV first came out, we got to bypass that, especially in our black community. Taylor also make it a point to educate the community that HIV is no longer a death sentence. Instead, with medication, one could be undetectable for the virus. On Friday, December 6th, Love the Golden Rule Clinic will throw a free community event for World AIDS Day. We're going to have an availability of people to stop in and see us at Love the Golden Rule so we can help get people to test for HIV, Wallace said. We want to test as many people as possible. In addition to HIV testing, they'll also test for hepatitis C and provide free flu vaccines. To get help or to have any questions answered about sexually transmitted and communicable diseases, please contact www.cdc.gov/info. That's the Center for Disease Control.gov/info. A service of the United States Department of Health and Human Services, which is HHS. It offers access to the latest federally approved HIV and AIDS medical practices, guidelines, HIV treatment and prevention clinical trials, and other research information for healthcare providers, researchers, people affected by HIV and AIDS, and the general public. The hotline to call for help is 1-800-448-0440 or 1-800-HIV-0440. The CDC website, which is the Center for Disease Control, also has the Clinician Consultation Center, which includes the Clinician's Warm Line, which provides healthcare providers with expert clinical advice on preventing and treating HIV. So this would be the one that teaches people like me who is the healthcare worker how to care for and prevent or how to care for and prevent HIV and AIDS when working with patients. The phone number for the clinician consultation is 1-800-933-3413. They also have a perinatal HIV hotline, which provides clinicians with around-the-clock advice on indications and interpretations of HIV testing in pregnancy and consultation on okay, let me read this again. This provides clinicians with around-the-clock advice on indications and interpretations of HIV testing in pregnancy, and consultations on antiretroviral use during pregnancy, lab during pregnancy, labor and delivery, and the postpartum period. That number is 1-888-448-8765, and this is available 24 hours a day, 7 days a week. And that's the hotline for the perinatal HIV hotline. That concerns pregnancy and women who are pregnant, who are suspected to have HIV/AIDS or have been exposed to HIV or AIDS. Yes. There's another one, it's called PEPLINE. The PEPLINE provides expert guidance in managing healthcare worker exposures to HIV and hepatitis B and C. For that number, you call 1-888-448-4911. And they have a substance use management, substance use evaluation, and you can call that number at 1-855-300-3595. So there is the information for you. If you suspect that you have been exposed to AIDS or HIV, if you have questions, there's a hotline for workers workers like myself who work in the medical field who have been exposed to AIDS or HIV. There's a hotline that you call for help. My suggestion is that you put yourself on every 6 months regimen of testing for AIDS and HIV until you can see a few results of your condition as far as being negative. My suggestion and what I've been told is that if you have been exposed by AIDS or HIV, it's best to contact your doctor as soon as possible. Go to an urgent care, go to a clinic, go to a hospital, explain the situation, and they will start testing and give you information that you will need in order to help you deal with that situation, because that situation is not only a medical, not only a physical issue, it also can be a mental issue where people can become sad and depressed because of their situation. So I'm just bringing awareness to you that the AIDS and HIV is rising in Black women, and it's rising in Florida, of all places, Florida, right? Soon it's going to be in other states, if it's not there already. My question is, why is there all of a sudden a rise in HIV and AIDS? And why is it that is happening to our Black women? That's my question, right? I work in the medical field, so I'm always in situations where I could be exposed to sharps that are contaminated. I'm exposed to needles that are contaminated. And so it's a possibility that you could have an accident in the workplace, or you could have a patient that attacks you with a sharp that's contaminated. And that's another way that you could possibly be infected. So there are many ways. You have sexually transmitted. That's a way that you can get AIDS and HIV. You can get it through substance abuse. They do have a substance hotline that I did leave the number for that. And substance abuse means that the person is using sharps or needles for their drug addiction or their substance abuse. And that's a way that you can also get AIDS or HIV transmission through what they call dirty needles or contaminated needles that have been used for substance abuse. Another way that you can get it is, like I said before, on the job. A job injury in the medical field, working in a nursing home, hospital, um, any kind of medical facility where there are sharp needles and objects that can possibly transmit this disease. Um, you can also get AIDS and HIV through the fact that your unborn child, a pregnant mother, she can also um, end up getting HIV or AIDS, contracting it, and they have a hotline and they have resources to help once they have tested the pregnant mother and found that she is positive. They will take measures to try to uh, stop the unborn child, the fetus, from developing um, the AIDS and HIV from the mother. So there are research and prevention medication that is here now that was not available many years ago when the virus first um, was exposed to our society, before we even understood what AIDS and HIV was really about. There was not a lot of research done. There was not a lot of resources, not a lot of education. There was a lot of stigma. Um, a lot of people were alienated and abandoned, um, discriminated against. But time has changed, and uh, now people are able to get the help that they need in order to live a longer life. Um, this is a this is a deep subject. AIDS and HIV. It's on the rise again. So use protection. Protection is not 100%, but condoms do help to protect you from sexually transmitted diseases. HIV is a sexually transmitted disease. Abstinence is a good way to go. Abstaining from sexual activity, abstaining from substance abuse and drug use. Um, yes, try to eliminate certain things in your life that could possibly cause you to um, get infected in some way. Until next time, this is Marie's Message 411 TV, and this is Nurse Marie bringing you this video, bringing you some awareness about the rise in HIV and AIDS in Black women, and it's happening right here in Florida. Um, leave your comments in the comment section and let me know what you think. If you don't know how to um, share what's going on with you, there are some numbers that I left for you that you can call and speak to someone, and they are available 24 hours a day if you need to talk to someone. This is Marie's Message 411 TV. Leave your comments in the comment section and let me know what you think. Click like, click share, subscribe. Click the notification bell so that you can get updates to my channel, to my videos that are coming up in the near future. Be good to yourself and be good to others. Respect others if you want to be respected. Be safe and protect yourself. And until next time, this is Marie's Message 411 TV. Nurse Marie saying, bye-bye.